Once we have the original thought and the opposite, you simply ask the client, okay, what's something more in the middle? And this isn't necessarily what they believe. This is simply, at least at first, a completely theoretical exercise. We have the original thought. That's your automatic thought that you have. No one needs to plant that in your head. You already have that. We came up with the opposite extreme. What's something more in the middle? Sometimes you might have to help them come up with the middle thought. This might be such a foreign concept that they can't even do it. So you might have to help them with that. But eventually, you want the client to come up with their own middle thought, and especially on their own. And here's why. If they come up with the middle thought, part of them does believe it because those words came from their brain. If you're the one coming up with the middle thought, they don't have to believe it because that's just you. And what do you know? You're just the therapist. You have no clue what it's been like for me. But when it comes from them, well, their own brain produced that middle thought. And so sometimes as you're helping a client come up with the middle thought, it's not as close to dead center as you would like. That's okay. It doesn't have to be dead center. And it certainly doesn't have to be your dead center because any thought that's different from the original thought is already helping them be more dialectical. Remember, that's the whole point of this. Help them become more dialectical. Help them start to see things from a slightly different perspective. So over time, of course, you can help steer them, nudge them more towards the middle, but it needs to be their middle thought.